Hello everybody, my name is Colin Campbell, and for the last 3 years I've had the pleasure of working for one of the best performing ACOs, independently owned by physicians in the United States. I'm here today to share a few easy tips and tricks that will allow you, the independent physician, to remain independent and set up an all-star performing office within the ACO. Today I have an important topic to talk to you about. It's broken down into 3 parts. One is assignment, one is transitional care management, and one are medical call services to tie all these pieces of the ACO together. So in about 10 minutes or less, I'm going to teach you how to improve the quality of your practice while increasing revenue of your practice as well. So what is the definition of assignment? Assignment is a 2-step process where Medicare allowable charges are tested for primary care physicians before specialists. So a Medicare beneficiary's charges for primary care physicians are analyzed to see which primary care physician has provided the most allowable charges for that particular Medicare beneficiary. If there are no primary care services provided to a Medicare beneficiary, the assignment is moved to a second step, which tests the specialist charges. So, in the end, $1 of primary care service charges will trump $100 of specialist charges, and therefore the patient would be assigned to the primary care. If no primary care charges, then it's assigned to the specialist. So, assignment provides a big opportunity in the United States for physicians. Approximately 50% of Medicare beneficiaries are assigned to a practice. The other 50% are not assigned. So therefore, a physician is not being given credit for all the hard work that they're doing. The key to picking up the additional 50% of unassigned patients is seeing the patients more in the annual wellness visit. Physicians can win or lose their patients by 1 or 2 visits. The Medicare provides a statistical probability whether a patient can be won or lost in that practice, and the physician could be given credit for that particular patient. So patients can be won, 50% of the patients can be won by 1 or 2 visits, and 50% of patients can be lost by 1 or 2 visits. So it's absolutely critical to see your patients enough. So additionally, the ACO reimburses the physician for their hard work, and Medicare rewards the physician for their hard work. At the end of the day, Medicare fee-for-service charges added to the ACO check at the end of the performance period can in many cases be twice as much reimbursement as commercial insurance. So consider reviewing your payer mix and taking a look at that. Consider giving Medicare patients priority on the schedule, and see your chronically ill patients 4 times a year. So the 6 critical questions for the annual wellness visit program are this. If you have an annual wellness visit program in your office, try to answer these affirmatively. Do you run eligibility on all Medicare patients? Yes or no, to check the G codes. Are all Medicare patients getting an annual wellness visit if they qualify? Yes or no. Does your care plan include seeing all chronically ill patients 4 times a year? Try to assign a superstar provider in the office to be in charge of the ACO initiatives and the annual wellness visit program. Are all no-shows rescheduled? A lot of annual wellness visits tend to be no-shows, so we have to follow up on them. And then once they do show up to the office and you perform the annual wellness visit, do all patients leave the office with a follow-up visit? Now, section 2 I'd like to talk briefly about is transitional care management. So first section we talked about seeing your patients a lot. The second section we're talking about transitional care management, which is provided payment to you, and after the patient leaves the post or the acute care setting for post-acute care. It's care management services provided for the patient following a discharge from inpatient hospital setting. So inpatient hospital setting can be an acute hospital, rehab hospital, psychiatric hospital, long-term, partial hospitalization, observation status, or skilled nursing facility. So as soon as the patient is discharged to his home, a rest home, or assisted living facility, then the physician, the primary care physician, can begin to perform transitional care management. Transitional care management can be performed on moderate complexity or high complexity. And then there's different elements that are required for that. You have to contact the patient within 2 business days of the discharge. That can be direct telephone contact, electronic contact, or direct conversation. Within 14 days, there has to be a face-to-face visit with that particular patient, medical decision-making of at least moderate complexity during that particular period. On high complexity patients, the medical decision-making of high complexity during that period, it should be done within 7 business days. Those are also very nicely reimbursed by Medicare to you as a practice. So what are some of the compelling reasons to do transitional care management? Well, TCM codes, transitional care management codes, will count towards assignment in 2016. So you'll be given credit for seeing that patient in the post-acute care setting, which will also give you the ability to receive assignment and credit for that patient. 50% of all discharges result in readmissions. Another important reason to see the patient once they're discharged from the hospital, they'll end up back in the hospital again. Heart failure, 55% are readmitted. COPD, 50% of patients are readmitted. Diabetics, 45% are readmitted. It also provides immediate revenue to the practice of approximately $200 for the transitional care management. Every admission costs the ACO in your practice about $3,750. So transitional care management for the Medicare beneficiary is critical. So there's also 6 critical questions to ask yourself with transitional care management. Do you receive the hospital and SNF discharge information daily in your office so that you're able to meet the requirements for transitional care management? Are you contacting all Medicare discharge patients for TCM visits daily? Who will be the super office for transitional care management in your office? Who is in charge of that particular program? Are all no-shows rescheduled and called within 24 hours? And do all patients leave the office with a follow-up appointment? You want to try to answer all these questions affirmatively with a yes. The third section I'd like to talk to you briefly about are medical call services. Many ACOs are putting a medical call center in the ACO that will help initiate a lot of the different clinical initiatives that are taking place across the ACO. Medical call center services are very important, and it's a great support mechanism for the physician. You're not in this alone. You have support. Your ACO will support you. Medical call center services can focus on different initiatives. One could be the annual wellness visit program. They can help your practice a little, or they can help your practice a lot. They run reports. They check eligibility. They call. They schedule patients. They follow up with patients to see if they made their appointment on time. They provide training, and they provide systems and processes for your office. Very important. They can help you a little bit, or they can help you a lot. They run programs such as triaging and after-hours call once your office closes. Critical to be able to see your patients at nights and on the weekends. They triage them and get them to the right site of service. They run ER frequent flyer programs, which allows them to run reports to find out which one of your patients end up in the ER the most, and they can reach out and touch those patients and find out how they're doing, get them in to see you on a regular basis in your office. So, in conclusion, what can you do tomorrow morning, and what 3 easy steps can you use to provide better quality to your patients and increase revenue to your practice? Well, number 1, you can establish and work your Medicare patient assignment. You're only getting credit for 50% of the hard work that you're performing. Medicare wants primary care physicians to see their patients more because they know they'll keep them healthy and probably ultimately keep them out of the hospital. You want to get access to eligibility systems. All Medicare patients should get an annual wellness visit if they qualify in your office in a timely manner. Chronic patients should be seen at least 4 times a year. 70% of all Medicare patients are chronically ill. You want to establish and work a good after-hours call and triage program for your office. You want to work on the front end, the emergency department visits, transitional care management on the front end, and then on the back end of the discharge, you want to work your TCM process as well. So transitional care management coupled with a good triaging and after-hours call program will provide great results for your practice. Number 3, you want to utilize your medical call center whenever possible. Activate your ACO resources that are provided to you. It's your company. Take advantage of it. They can help you with annual wellness visit programs. They can help you with your triaging and after-hours call. They can help you with your ER frequent flyer programs, care coordination of your sickest patients at the end of the day. They will be there to support you and to keep the independent physician independent long-term.